Assalamu alaikum everyone. I am Aseel Abdul. Our seminar about Hashimoto thyroiditis, presented by me and my colleague Zeena waad, supervised by Dr. Zahraa Marwan. What you need to know about Hashimoto's disease. Hashimoto's disease or Hashimoto thyroiditis. It is autoimmune disease that damages the thyroid gland. This form of thyroid disease may also be referred to as a chronic lymphocytic thyroiditis. The name of Hashimoto's thyroiditis is derived from 1912 by Dr. Hashimoto through describing patients with goiter and intense lymphocytic infiltration and considered the common cause of hypothyroidism. Hashimoto's thyroiditis is more common in women than in men and most often appears between 40 to 60 years. The main cause of Hashimoto's disease is still unknown, but we have a major risk factor include the sex. Women are more likely to get Hashimoto's disease. Age. Hashimoto's disease can occur at any age, but more commonly occurs during middle age. Genetic. A family history of Hashimoto's disease increased risk for Hashimoto's disease. Having another autoimmune disease such as Graves' disease, rheumatoid arthritis, type 1 diabetic also increase the risk for Hashimoto's. Excessive iodine. Research suggests certain drugs and too much iodine cause Hashimoto's disease. Radiation exposure. A lung exposed to radiation will also increase the risk for Hashimoto's. What is the pathogenesis of Hashimoto's disease? Hashimoto's thyroiditis, it is autoimmune disease in which the immune system reacts against a variety of thyroid antigen. There is a progressive depletion of thyroid epithelial cells, which are gradually replaced by mononuclear cell infiltration and fibrosis. To know how the thyrocyte death, we should know the three mechanisms. The first one, there are activation of CD4 cell, which also known as cytotoxic cell. This leads to injure the thyroid epithelium. The second one, we have the activation of CD4, lead to produce various cytokines like interferon gamma, which lead to activation of macrophage and damage the follicle. There is activation of a plasma cell. These cells will make antibodies, like antithyroid antibodies and antithyroid peroxidase antibodies. And these antibodies further cause antibody-dependent cell-mediated cytotoxicity. This picture explains how the thyrocyte death. As I said before, we have three mechanisms. The first one, we have activation of CD4 that leads to damage of the epithelium of thyroid gland. The second one, we have activation of CD4 that is produce interferon gamma, and activation of macrophage will lead to damage the follicle. And the third one, we have a plasma cell that produce antithyroid antibody that is lead to activation of antibody-independent mediated cytotoxicity. Thank you for listening, and now my colleague will continue.
Hi, I am Zeena. I will start with the morphology of the Hashimoto's disease. The morphology of Hashimoto's disease in gross appearance. Look at the picture. We will see the gland is diffusely enlarged symmetrically, bilirubin, firm and rubbery. And in histological features include lymphoid cell infiltration of lymphoid follicle having germinal center, small atrophic and keloid deficient follicles, presence axophyll cytoplasm and large irregular nuclei, and the slight fibrous thickening of lobular septa. In this picture, we will see follicle are atrophied and nucleoid follicle linked by Hurst cell and also in sheets. Lymphoid follicle germinal center formation. Now, what are the symptoms of Hashimoto's? It is difficult to recognize sign or symptom of Hashimoto's disease initially, but you may notice a swelling at the front of your throat. Hashimoto's disease is slow to progress and cause chronic thyroid damage, leading to significant drop in thyroid hormone level. Symptoms of Hashimoto thyroiditis are the same as hypothyroidism. في هذه الصورة راح نختصر كل الأعراض اللي ممكن راح نلاحظها عن مرضى الهاشيموتو. We will start in the CNS. We will notice problem concentration, new or worsening depression, moodiness, forgetfulness, and in the cardiovascular system, we will notice a slow heart rate, and in the GIT constipation, and in the genitourinary tract, we will notice weight gain, fluid retention, heavy or irregular menstrual cycle, infertility, and the most other symptoms we will notice with patient in Hashimoto's disease like hair loss, brittle hair and nail, puffy face, hoarseness, elevated cholesterol, loss of energy, resistance fatigue, increased cold sensitivity, joint pain, muscle cramp and stiffness, numbness or tingling, dry itching skin. Now, how do doctors diagnose Hashimoto's disease? Number 1. The doctor starts with medical history and physical examination. Number 2. Blood tests include a TSH test. If we detect even tiny TSH in blood above normal level, mean the person has Hashimoto's. B. T4 and T3 test. The low level of T4 means the person has Hashimoto's. C. Anti-thyroid body test. We look for the presence of thyroid autoantibody. 3. Other tests like ultrasound and CT scan. Now treatment. Hashimoto thyroiditis is treated by releasing hormone that your own thyroid can no longer make. You will take levothyroxine. Levothyroxine, a thyroid hormone medicine that is identical to a hormone the thyroid normally makes. Your doctor may advise that you take the medicine in the morning before you eat. In this picture, she takes the levothyroxine, and this is the difference between before and after take the treatment. Now, what should I avoid eating if I have Hashimoto's disease? The thyroid uses iodine, a mineral in some foods, to make thyroid hormone. However, people with Hashimoto's disease or other type of autoimmune thyroid disorders may be sensitive to harmful side effects from iodine. Eating foods that have large amount of iodine may cause hypothyroidism or make it worse. Taking iodine supplement can have the same effect. في حالة الإصابة بأمراض الغدة، لازم إعادة النظر في النظام الغذائي الذي يتناوله المريض، ولكن هذا لا يعني التوقف عن هذه المأكولات، ولكن لا يجب الإفراط في تناولها، مثل فول الصويا والقهوة والحليب والدهون والأطعمة المعلبة والأطعمة الغنية بالألياف. And that it's Revenus, and thank you so much for listening of our seminar.